Can I just ask, how did you guys go about organising your experience? Because I've got a few funny stories about that. But I will ask you guys first.
I did my original work experience through my school.
Okay.
They had a lot of contacts,
Yeah.
So I used them. But then I also did some other work experience. I knew I had a family member who knew a radiographer in my local hospital. So I contacted them, and I found it was a lot easier to get a response if you knew someone personally, if you knew their name and could contact them specifically, rather than just writing to a department or a hospital.
No, but I think even if you don't know somebody within the institution, I think you can just my GP, for example, I just sort of approached him. Knows my mom quite well because she's quite a difficult patient. Doesn't always take her antihypertensives. So as soon as I mentioned her name, she was like, "Oh, you're this lady, you're like Miss Ray's child." I was like, "Yeah," and it was like, "Yeah, of course, yeah, anytime." But I think even without that, I think he was approachable enough as a good GP
I just applied to my
that
local
he would have been fine.
I just applied to my local hospital, and I didn't know anyone in this country who's healthcare related or anything. But yeah, you just apply and you wait for your application. Fair enough, you have to apply a bit more in advance just because it takes a bit longer to process applications and so on.
Yeah.
But it doesn't mean that you can't get into work experience if you don't know someone.
Definitely, and like my careers advisor was like militant. He started me out with one placement when I did a couple of weeks in the ITU department. But after that, he was always telling me to go and knock on doors, and at first I was a bit shy, but eventually I did the same thing. Went to the local GP, asked the GP, literally just turned up, asked the GP. I got a 1 month stint with him. I went to a local it's actually a privately owned Alzheimer's care home, and I thought initially because it was privately owned, I thought they won't allow some child to come in and do work experience. But if you don't ask, you don't get. And I went in there, asked them, and initially they were like a bit iffy, a bit no, we don't really know who to refer you to. We don't really deal with this. We've never had this before. And then I just kept them annoying them for a couple of weeks, and then I ended up working there for 6 months every weekend.
Yeah.
Because at the end of the day as well, I think especially the care home setting, I could help out in terms of give meals and help the nurses and help the staff, and I'm offering myself free, on a plate, and eventually someone will take you up on the offer.
Yeah, if you could show them what you can do for them, then that's going to help them take you on.
Yeah, even if you're serving coffee in a hospital or in a care home, you're still close to doctors and to nurses. And while you're close to them, you can ask them if you can shadow them, say for a morning or for a week or for a month or whatever it is.
I think once they sort of realise what your career aspirations are, they do sort of like warm up to you and do respect that you're actually making an effort to get involved and to actually do something that will obviously enhance your chances of doing
Just
your
to come back to one of the things that I think Michael said, you don't use like any experience is good experience. I think one of the things I did as well was when I worked at a Jerry's firm for a month when I was doing work experience. Initially, obviously, I was just like any other college student, not really knowing what to do, just hanging around and following the nurses, asking questions. But in the end, I remember one of the patients asked me if I could give him a shave, and I asked the nurse if I could. The nurse was like, "Okay, yeah, go ahead." And then all of a sudden, the whole ward, all the men on the ward wanted a shave, and then for 2 weeks that became my job. Every morning I'd shave all the men. But I mentioned that in my interview.
Very interesting.
And I got to talk to the patients, and I got to learn about their conditions, and they'd tell me about their conditions, about their family life. And I think at first I was just thinking I'm wasting my time, but by the end of that month I realised it actually improved my bedside manner. It really did.
It's not just getting the work experience, like shadowing the doctors and seeing what they do things. It's actually getting the experience with the patients, communicating with the patients, learning what the patients actually have, how you deal with patients.
Yeah, and
it
even
also makes you feel better about yourself.
Exactly,
it's so fulfilling.
A warm,
it's so
fuzzy
rewarding.
feeling. That's how I describe a warm, fuzzy
feeling.
feeling.
You'd be surprised what patients are actually willing to tell you that they won't actually tell
the
doctors.
With
It's
the
really good.
healthcare professionals.